guess everyone has become familiar with the Ramsay Hunt Syndrome in the past week because of what happened to Justin Bieber. But we in medicine, especially in ear, nose, and throat, typically will see this many times first. Most of the time, however, when I see this disease, it's been treated at or been seen by an emergency room previously, and it comes in as ear pain. Typically, what diagnosis is the fact that you have blisters in your ear along with facial paralysis and severe pain. What I look for a lot of times is pain in the ear where there's no physical cause for it. And many times early on, the diagnosis is missed. I had a patient come in approximately 2 months ago. A 20, 30-ish year old lady came in because of severe pain in her left ear. And she had been to an emergency room 48 hours before at one of the local institutions, and they gave her eardrops for it. This isn't uncommon because without the characteristic triad that you see, which is facial paralysis, severe pain, and the blisters, sometimes it's a little difficult to diagnose. But the most characteristic issue turns out to be, and feature turns out to be, the paralysis of face. And that really gets a lot of attention from people, obviously. There are other things that can cause paralysis of the face, including Bell's palsy and stroke and other issues. And many times when people come in, they're afraid that they actually are having a stroke. But with this lady, when she came in to see me, she had rather typical symptoms. And even though we don't see a lot of this problem, most of us are very familiar with the diagnosis, but many times it's diagnosed as Bell's palsy and treated as such, and which is not altogether bad as long as many of the same medications that you use for this with Bell's palsy can be used for Ramsay Hunt. But still at the same time, it's good to make an accurate diagnosis. So when I see someone that comes in with severe pain in the left side or the right side of the ear, the auricle, as we call it, the outer part of the ear, and the pain is really intense. It really does go through my mind, is this possibly an early feature of the disease? It's quite important to actually get the treatment started on this early, within 48 to 72 hours ideally, because without that, sometimes lingering long-term consequences of the facial paralysis particularly can be really distracting and rather serious. Serious because the face is actually paralyzed basically from one half of the face and down the middle to the side, where you can't close your eye, and smiling becomes difficult is one of the more characteristic features of it. When I see this, I also will have the person go and see an ophthalmologist, particularly if they cannot close the eye and the eye is exposed. And if you have the cornea that can get abraded and form scarring, you can have permanent visual problems. The second most important feature turns out to be pain, and pain control turns out to be a big issue. They have excruciating pain. I have pictures, unfortunately, because of HIPAA, I can't show the real agony on the face of the lady that I saw. She couldn't close her eye, and she had severe pain, and she was really agonizing. And having been to the emergency room and not received any significant improvement, she was really in an extremis as far as aggravation and pain and discomfort when I saw her. This condition is due to a virus, the same one that causes chickenpox and as a herpes virus, and there's no real known reason why some people get it. It's the same virus that actually causes chickenpox, and this virus many times will flare up. You don't really quite get rid of this virus. It comes back again and tends to flare up when there are conditions that predispose to it. And what these conditions are, in my own view, it has to do with immune dysfunction, and probably stress, and a lot of other things can be included in probably some of the issues that might cause this to flare up. But no known real causes can be brought to diagnosis type thing. I mean, to cause as a cause. Same thing with prevention. having a healthy immune system, whatever that means, actually, makes a big difference. With the flare-up of the recent COVID virus, one would wonder if either the shot or if COVID, the features that tend to milk and wear on your immune system could actually cause this. And there's no evidence that it does, but these things are multifactorial in many instances, and it's probably not just one feature that causes your immune system to actually be impaired, where one of the weaker aspects of your system, and many times with this virus in the background, can be flared up when this actually happens. It's important to get, as I said, to diagnose it early so you can get treatment within 48 to 72 hours. The longer you wait, it seems that the longer the disease will take to recover. The lady that I saw recently, we recovered within about 2 weeks, where she had a full return of function, and she was able to smile, her eye was able to close, etc. But it was important for her to see the ophthalmologist to make sure that she would sleep with her eye taped in order to avoid exposure there. And also she was put on physical therapy early on, which is not always done. And then steroids, which are an anti-inflammatory. Like as with many of these diseases, it turns out that inflammation is a cornerstone of most of this. And so taking care of the inflammation, which causes the nerve to actually swell and put pressure against it, which causes extreme pain, which is one of the things that actually can help. And putting patients on antiviral medication and eye drops, obviously, to lubricate the eye, and pain medication, obviously, to reduce some of the more aggravating aspects of it. But at any rate, the importance of getting early treatment and not missing a diagnosis. And the diagnosis is missed many times, particularly among emergency room staff, for a couple of reasons. Number one, because it's early on and all of the features aren't there, and also too, they don't really see this very often, so it's not in the forefront of their mind as it is with the specialists who see these diseases, not necessarily frequently, but is aware of the algorithm and the number of things that actually can cause excruciating pain without sometimes really convincing physical findings.